organizations has launched 5 different projects aimed at improving nutrition, especially for children in refugee hosting communities. The approach uses local innovations to solve humanitarian challenges. We have a detailed report.
Uganda currently hosts an estimated 1.4 million refugees, with majority coming from South Sudan and the Democratic Republic of Congo, DRC. However, refugees and the hosting communities face a number of challenges, one of them being poor nutrition, particularly among children. To address these challenges, Response Innovation Lab Uganda, a global network of field-based labs aimed at finding solutions for humanitarian challenges, has launched 5 different projects to tackle the problem of malnutrition among children in refugee hosting communities.
At the moment, the funding available for supporting them is reducing, which means that it's very hard for them to sustain their families, and we can see that young children are not getting the right food that would allow themselves to develop to their full potential. It's really critical that children receive the right nutrients between the time of conception up to 2 years of age, and right now these opportunities for families are compromised. So we decided to look in Uganda, in the very rich and innovative ecosystem of Uganda, if we could find solutions that would be bringing relief to those families.
One of the innovations to be implemented in RIL Camp refugee resettlement in Arua district is the solar drying project that will help women earn money from dry agricultural products.
The solar dryer, how does it help the refugees? Is that usually during the dry season, there is not enough vegetables for refugees to consume. So you find that there is very low consumption of vegetables and fruits during the dry season.
Glue University will implement the application of millet, simsim and soybean to solve chronic malnutrition.
Our product meets the protein requirement which is needed for the growth of children. And when we talked about chronic malnutrition, protein is very important because it is needed for body growth. It also meets energy requirements for children. And micronutrients, especially vitamin A and iron, but also other micronutrients.
Health for Entrepreneurs Uganda, a non-government organization, will also ensure basic health access and promotion in the refugee hosting communities.
So we work with PhDs that are in very much remote and rural areas. We give them an opportunity to become an entrepreneur. So they get a training from us, they get a smartphone that has health educational apps, a product application. They get credit to start a very small health shop.
Response Innovation Lab Uganda is hosted by Save the Children, and the 5 different projects designed to tackle malnutrition in refugee hosting communities in Arua and Chekegwa will last 2 years. Adia Nakuti and Jamil Sekaja, UBC.
Look.